We used to think that addictions, mental illnesses, chronic diseases like heart disease, lung disease, diabetes, obesity, and criminality, violence, were all in the human nature, that we couldn't change them. We had to live with them forever. But that's not the case. According to studies, really quality studies from Kaiser Permanente, CDC, and scientists who have earned Nobel Prizes for their work, stressful experiences, I call them toxicities. Toxic people, toxic environments like air pollution, water contamination, toxic systems where people are put against each other and our natural tendency to express our fullest, truest potential is blocked in many different ways. These are actually linked to all the problems that I mentioned, and in a very measurable way. You see, Adverse Childhood Experiences study, for example, back in 1996, found that when you experience 4 types of toxicities, it may be abuse, neglect, emotional, sexual, physical abuse or neglect, someone in your family having an addiction or being incarcerated, being a child of a divorced household where parents have left the child, basically, abandonment. These 4 types of these connected can be related to, linked to 4,600 times percent more risk of using injection drugs in adulthood, 700% more risk of becoming an alcoholic, 200% more risk of developing heart disease and lung disease, major problems in the COVID-19 epidemic, 300% more risk of suicidal ideation. And it goes on and on like this. People who have beaten their wives, their children, perpetrators of domestic violence are usually people who have 9 or more different types of these diseases. These are from studies over the last 25 years that have been implemented in prisons. So there's plenty of research out there, and today we know the mechanism by which this process works, and we know that, for example, these toxicities actually change our gene expression and shorten our telomeres so that we die on the average of 20 years or so. Now, you're going to say, we know all this, then why is nothing changing? Healthcare is a $10 trillion business per year. And there's a lot of people, a lot of companies who are very powerful and who have a lot of stake in things staying the same. And after training doctors and nurses and psychotherapists about the impact that I'm sharing with you today, I've realized that change is not going to come from professionals like us who have a lot to lose if a health company decides that we're talking too much, to be very honest. But it's going to come from people like you out there who understand what's going on, who understand the solutions and are tooled with devices that we have today to help decrease the symptoms that develop from extreme stress exposures, and inform everyone around you and start demanding systemic change to eradicate some of the sources that cause these toxicities.